Thank you for joining us. This is Aishee Patterson with the Restaurant Association Metro Washington, and I'm here with Purvi from DC Health Benefit Exchange. Purvi is the chief, I'm sorry, Purvi, I'm going to get your title wrong, but Purvi will introduce herself. We have worked with DC HBX for many years. I believe we're on 8 or 9 years in an effort to make sure the restaurant community is well aware and well informed of all the benefits that providing health insurance through DC HealthLink is for their employees, as well as making sure that the employees know, for those of you who do not offer health coverage, that the individual benefits of getting health coverage through DC HealthLink are plentiful, and that is something they should be looking into, as well as employers for small businesses looking into providing insurance. So with that being said, Purvi is going to go through all of the current incentives that are available during the COVID-19 pandemic for small businesses that are interested in covering their employees, keeping their employees covered, and also for individuals who may need coverage right now. Purvi?
Hi, everybody, and thank you, Aishee, so much for having me here with the Restaurant Association of Metropolitan Washington. You've been wonderful partners on getting information out about healthcare coverage to people across the DC area, and we're really grateful. And I'm really glad I could be here today to share the latest information, something that you may learn, something you can share with others, and just really spread the word. So even if your colleagues can't be here today, please definitely let them know. I believe the Restaurant Association is going to be posting this, so you can refer them to that, and I'll give you other resources as we go along. So as Aishee said, I am Purvi Kempf. I am the General Counsel and Chief Policy Advisor at the DC Health Benefit Exchange Authority. And I'm going to go ahead and put up my presentation. And we can get going that way. Okay, so, and many of you will have heard of us. We are DC HealthLink. That is the name under which you will definitely have either seen some sort of advertisement, maybe someone you know has gotten insurance and they've gotten it through DC HealthLink. So let me go ahead and get started so you understand who we are. Back in 2010, and we just celebrated the 11th anniversary, there was the passage of the Affordable Care Act. It was also affectionately known as Obamacare. And shortly thereafter, the DC Council created and passed legislation to establish the DC Health Benefit Exchange Authority. And that is our local healthcare marketplace. We are a public-private partnership. We advocate for the lowest possible premiums, for the best products and real choices through the private market competition. And all of the private, all the products through DC HealthLink, really having everyone come through this portal means you're getting a transparent, competitive product that all of the carriers are able to show you in one place. So how is the ACA working for the district? And the really great thing is it's been working extremely, extremely well. So DC ranks number 2 in the US for the lowest uninsured rate. That means more than 96% of our DC residents are covered, which is really great. But people have changes in their circumstances, and it's important to know where your next step is going to be. We did, as a part of the Affordable Care Act rollout here in the district, cut the uninsured rate in half since DC HealthLink opened for business. And for the small group and individual market together, which is all of the small businesses and people who buy insurance on their own, not through an employer, we cover over 100,000 people with private health insurance coverage. And we also offer dental plans. There are 5,100 district small businesses and nonprofits that get coverage through DC HealthLink. And we have over 100 brokers for you as a business to partner with to help you enroll, because you need to be an expert in what you do, and you can get the free expertise of a DC HealthLink broker to help you enroll in coverage. So the DC HealthLink offers for small businesses. So if you are an employer looking to offer coverage or already offering coverage, we offer 163 small group plans. That's an increase where we had 156 in 2020. And we offer 25 plans for individuals who are purchasing on their own for themselves or their families. And what's really great to note is that 15 of those plans for 2021 have lower premiums than they did in 2020. Also, as a part of those 25 plans, if you're buying insurance on your own or for your family, those they're standard plans, which means we helped make the marketplace a little bit more transparent as to what you're getting, so you can compare across carriers. These standard plans, and they're marked as standard plans, have no deductibles for primary care specialists and mental and behavioral health, or they don't have deductibles for urgent care and generic drugs as well. And it's really important because sometimes you buy the insurance and you want to then go access coverage and it becomes too hard. So a standard plan is a great thing to look for. The insurance companies that are through DC HealthLink, there are 3 United Healthcare companies offering insurance coverage, 2 Aetna companies offering insurance coverage, and both of those are United and Aetna are both in our small business marketplace only. Then CareFirst, Blue Cross Blue Shield, and Kaiser Permanente offer both in the individual market, which means if you're buying coverage on your own or for small businesses. It's sometimes helpful to know what the landscape looks like. So here, as of January of 2021, we have again 5,182 businesses. That means over 80,000 people covered through those small businesses. And what's really great about the small business marketplace here in DC is that you have a choice of health plans. So you can save money, you can pick the plans that work as your reference plan, you can provide your employees the choice that large employers only used to be able to offer before the Affordable Care Act. And we make it administratively easy for you. There's no extra work for you to offer that choice. You will receive one monthly bill, regardless of how many different plans the employees select if you are the business owner. And all of these different types of choices make it so that someone can pick what's right for them, the right price point, and also the right coverage. So when we talk about employee choice, you as a business can allow your employees to pick a plan that from all of the plans of one carrier, all of the plans at one metal level, which means, you can get plans at bronze, silver, gold, or platinum. And those are you can go ahead and choose from all of our 4 different health insurance carriers, any of the plans that you want, or you can let them choose from all the different metal levels. That is a really helpful thing if you have employees that need different things, or you as an owner have a different need than your employees may. So let's focus on COVID-19 and what we're doing to help residents get insured. So we have expanded enrollment opportunities, and due to the COVID-19 public health emergency here in DC, any uninsured resident can sign up for coverage. And that means individual and family coverage if they're buying it themselves and aren't getting it through an employer, or if you work for an employer and didn't sign up through DC HealthLink, you can still sign up. And that's because COVID-19 is going on. You do not need to have COVID. You do not need to show anything. We've eliminated all the barriers to enrollment. You just need to go and sign up. And because of this public health emergency, we're allowing earlier start dates. Normally, you would get a start date that's in the next month or the month after. But under the COVID-19 public health emergency, you can get coverage starting the first of the month that you actually pick your plan. And that is a really helpful thing for some people, but you will get that choice. The other things to know, and this is really important for employers to understand, because we know your businesses are hurting, but it is a very hard time to go without coverage, and your employees may really want to have you structure that for them. So we have something called zero down. This is where we're allowing you as a small business to go ahead and offer insurance for whatever contribution amount you want to offer. And there is no minimum contribution and no participation requirements. We have waived them through 2022. So let me say that differently. You can go ahead and offer your employees insurance. You do not have to contribute more than you can, because we know your money flow situation is going to. All right, can you hear me now?
Yes.
Excellent. Sorry for that. I don't know why it disconnected my audio. The things we live with as we continue to try and work in this virtual world, my apologies for that dead air. Let me get back to what I was talking about when my audio disconnected. We were talking about zero down. And again, this is for employers. If you're an employee, you can let your employer know this. And if you're an employer and you haven't offered coverage, but you know how important it is to your folks, you can offer them coverage, and they can choose between all the plans, and you can contribute as little as you have to that coverage, but give them the easy structure for going ahead and getting that coverage. And then you can change that contribution amount over the years as you get your restaurant back on its feet. So again, this is through 2022. The other thing that's really important is right now, during this public health emergency, according to the Department of Insurance, Securities and Banking, the insurance commissioner has issued an emergency order. So they are not allowing termination of coverage for non-payment of premiums. So what that means is you as the employer, when you come through DC HealthLink, you will not be terminated during these months where we know your income is fluctuating. If we send you an invoice, you will not be terminated for not paying that full amount. We have stopped sending late payment notices, and we never, ever have charged late fees or interest for late payments. And that is very important because we know you're getting yourself back on your feet. These are monies that are owed, but you don't have to pay them right now. You will not be terminated. And then you may ask, well, then what happens? So you will have time to make that payment back. So we've created a new premium deferment period, so you can defer payments after the public health emergency ends for 60 days. After that 60-day period, the insurance commissioner put out an emergency order providing you 1 year to repay your past due premiums. That's 1 year past the 60 days we're giving you, after the public health emergency ends, that's the DC public health emergency, you will have 1 year to repay those premiums. We are making this repayment program automatic, so you don't have to fill out paperwork. We know if you owe money, and we will make sure you have that year to pay it back. We are also, since COVID started, have started eliminating barriers to care. So what is it that DC HealthLink gives you as an insurance plan? So health plans quickly and voluntarily added new COVID-19 benefits to help district residents and employers. They started covering diagnosis, testing, and treatment for COVID-19 at no cost to patients. They also cover the COVID-19 vaccine as no cost to patients. Now we know that's not there's different ways to get it, but you will not have to pay for it. And health plans also cover telemedicine, and some of them do it at no cost. So all of this information is up on a coronavirus information page. It is at dchealthlink.com/coronavirus. But if you just go to dchealthlink.com, at the very top, you'll see if there's coronavirus, a webpage link. And you can go there and you can find all of the different benefits that they have, the health plans have put forward to help you cope at this time while this pandemic continues to go on. There are a couple of federal developments I did want to go ahead and talk to you about. And so let me just start with reversing some of the very, very harmful Trump administration attacks on the Affordable Care Act and our population. So the very first thing for you to know is on March 9th, the Biden administration, its Department of Homeland Security, reversed the Trump administration's changes to the public charge rule. This is the rule that was really an attack on our immigrant populations, making them fear that if they go get actual coverage and help, whether it be Medicaid, which is the free coverage in DC, or SNAP benefits, and a host of other benefits, tax credits through the Affordable Care Act, that would be held against them if they ever applied for permanent residency. That has been reversed back to the pre-Trump rules. And it is so important to know that you should not be fearful any longer of anything that can be held against you. Please go seek healthcare coverage. It will not be held against you when you apply for permanent residency. Also, on January 28th, the Biden administration issued executive orders strengthening the ACA. And pursuant to those executive orders, they created a lot. They've done numerous things. One, and this was announced just last week, the federal government, which is healthcare.gov, for those states that go through them, that is not DC. We have DC HealthLink. But if you're in Virginia, for example, and you're buying insurance on your own, healthcare.gov created a special enrollment period lasting through August 15th that allows you to enroll in coverage or change a plan. As I said, in DC, we already have open enrollment for you. We have been able to do that because we have our own marketplace. But Virginia, for example, does not have its own marketplace. And now they are open for business through healthcare.gov through August 15th. Also, the Biden administration has been reversing very harmful regulations that advanced junk insurance or undermined coverage protections for people with pre-existing conditions and numerous other barriers to coverage. So they've been working hard to strengthen the ACA, and they've been working hard to combat discrimination. And in January, they ordered federal agencies to update their regulations and guidance to prohibit discrimination on the basis of gender identity, sexual orientation, including healthcare. So that is a really helpful thing. But let me tell you what you might be even more excited about. Aishi doesn't know I'm going to go and talk about this, but we are able to go ahead and give you updates on the American Rescue Plan. You may have seen that passed, and it has so many helpful things for people, but one of those things is huge amounts of help to get healthcare coverage to you for low or no cost. So let me walk through some of those things, and I am going to be here to answer any questions if you have any. So let me start with how the American Rescue Plan lowers health insurance premiums in 2021 and 2022. What I'm showing you is on our website. We have FAQs on dchealthlink.com about the American Rescue Plan. Everything you see here, you can see there. In addition, you can see numerous other FAQs, frequently asked questions. So I'm just showing these to you, and I'm going to talk you through them. But if you need to send anyone information, you can send them to dchealthlink.com. So if you are already getting premium reductions, what is the American Rescue Plan going to do? So if you're buying coverage for yourself or your family, and you weren't eligible for Medicaid because you're earning some amount of money above Medicaid, and you're getting a decreased premium, the American Rescue Plan decreases your premiums even more. And I'm going to show you some examples in a minute. But what if I don't qualify for reduced premiums under the Affordable Care Act right now because my income is too high? The American Rescue Plan reduces your premiums so you will not pay more than 8.5% of your income. This is new and it applies to everybody. And it is a huge benefit for people who are at higher income levels. They will never have to pay more than 8.5% of their income. So the Affordable Care Act had premium reductions for people who had incomes up to 400% of the federal poverty level. That's about $51,000 a year for an individual, and about $105,000 a year for a family of four. If your income was above that, there were no premium reductions available for you. That is not true anymore. Now having a higher income means you will never pay more than 8.5% of that income towards health insurance premiums. Some people like to see charts because the colors help them understand something, and what I would just point you to is the red line there. That red line is the amount that you have to pay out of pocket for private health insurance coverage for yourself or your family up till now. Under the American Rescue Plans, the blue line is what you pay, and you're going to pay less than what you paid before. And so let me give you some real specific examples. This chart, you may not be able to see this, especially if you're looking at this on your phone. So again, go to dchealthlink.com. This chart is there. But let me give you an example. If you're a 30-year-old and you have an annual income of $30,000, under the Affordable Care Act, you used to pay $200 for a silver plan. Now you're going to pay $90. If your income is $45,000, under the Affordable Care Act, you would have paid $332. Now you would have to pay $279. That's starting April 1st and moving forward, but it goes all the way back. It's for the whole year. So if you were a 45-year-old and you had an income of $30,000, you were paying about $202 for silver plan. Now you're going to pay $93. That's a huge decrease in the amount of money you have to pay. If you were a 60-year-old and you made $45,000, you were paying $382. You're now going to pay $288 for a silver plan. These are all examples to show you that there is more help, that the American Rescue Plan will lower your health insurance premiums in 2021 and 2022. So what else does it do? The American Rescue Plan, if you've been laid off, and many, many restaurants have to lay people off. So this is really important. So how does the American Rescue Plan help me afford private health insurance coverage if I've been laid off? The American Rescue Plan makes health insurance on DC HealthLink almost free. You can pay as little as $2 a month for private health insurance coverage. Okay, that's $2 a month for private health insurance coverage. How do you qualify for that? You qualify if you received unemployment compensation anytime in 2021. You don't need to be receiving it now. We know some restaurants are opening back up in greater numbers. Maybe you're starting to, you have an income coming again. So let's say you had unemployment insurance coming to help you the first week of January, and you apply for health insurance April 1st. You will still qualify for all of the rest of the year for insurance at about $2 a month because you received unemployment insurance for at least 1 week in 2021. This is really, really important. Now, do I qualify if I'm eligible for other coverage, such as Medicaid, Medicare, or other employer insurance? No, you do not. This is for people who have no other options. If you do not qualify if you're eligible for Medicaid or Medicare, or your employer is offering you coverage. This is if you were laid off sometime in 2021 and you do not qualify for Medicaid because now you're back at work and you have an income. You do not qualify for Medicare. You're under probably the age of 65. You do not have an employer offering you insurance and your spouse's employer doesn't offer you family insurance. Then this coverage, this nearly free coverage, is available to you. This is really important to spread the word about because this is only for 2021 and we want people to get access to these benefits. The last major thing that's really helpful that the American Rescue Plan did for people who were laid off. If I've been laid off, how does the American Rescue Plan help me pay for my COBRA premiums? So the American Rescue Plan pays 100% of your COBRA premiums. Now, I've used this fancy word COBRA, and some of you may have heard of it, others may not have. So what is COBRA? COBRA is continuation health insurance coverage offered by employers with 20 or more employees. Under federal law, those employers are required to offer at least 18 months of continuing coverage for their employees. And for those that are fewer than 20 employees, those employers that are small, under DC law, you have to offer 3 months of continuing healthcare coverage. So what does that mean? You worked for a restaurant, the restaurant started laying people off, but the restaurant is still there. They then are required to offer you, depending on their size, continuing COBRA coverage. But it was very expensive because you used to pay the full amount, and a lot of people could not afford that. Now, the entire COBRA premium starting on April 1 will be paid for. And how long will it last? It will last through September 30th of 2021. That's 6 months of free coverage that you can get if your employer offered you COBRA coverage and you're still within that window. Even if you didn't apply for that COBRA coverage because it was too expensive, a month ago or 4 months ago, you can sign up for that COBRA coverage now in April. And if you're still in that 3 months or 18 months, you can get it. You can get that COBRA coverage for free all the way through September. Let me tell you this other frequently asked question. I resigned from my job. Do I qualify for the federal government to pay 100% of my COBRA premiums? No, this is only for people who are laid off. They're the ones who qualify for the 100% COBRA premium payment. But so if you resigned or if you were terminated for gross misconduct, you do not qualify for the COBRA subsidy. But most of you who are laid off, you were not terminated for gross misconduct. It was an economic situation, and therefore you're going to be eligible for free health insurance. That's COBRA continuation coverage through your employer from April 1 all the way through September 30th. So all of these different types of pathways, the goal here is for everyone to be able to have a pathway to healthcare coverage, some pathway for reduced premiums, for free coverage if you were laid off, either through dchealthlink.com, through your employer, some different mechanism to make sure people have access to coverage. This is a lot of information. So I really understand that you may need to sit down with these frequently asked questions and share them. So you want to go to dchealthlink.com and click on the American Rescue Plan. And all of these and more federal frequently asked questions are there. That's also where you go to check if you're eligible for the reduced premiums. And everyone should be, it's really helping in a broad-based way. So everyone should go check. If you're buying coverage for yourself or your family, you may be able to get help paying more help than you have been. If you are someone who are getting it through your employer, then you may, and you were laid off, you may have COBRA continuation free coverage. These are all things that you can, again, go to dchealthlink.com and share this information with people. And then if you want to enroll and you need help doing that, maybe in a different language, you can call the DC HealthLink call center, and the number is on the screen, 855-532-5465. And you can get help in whatever language that you need to sign up for coverage if you aren't signed up, or to get access to those reduced premiums. So I really urge you to go ahead and what it says there, each one, link one. Reach out your hand to a family, to a friend, to a neighbor, to a colleague, and let them know that the American Rescue Plan is trying to make sure everyone has healthcare coverage. And now's the time to go check, even if they thought it was not affordable previously. Even if they had issues with immigration and they were afraid of the Trump administration rules. Things are different now. So now's the time to go check. So that's it for my presentation. I'm happy to take any questions, Aishi, if you have any, or anyone else. And otherwise, I really urge people to share this information.
Thank you so much, Purvi. That was very informative. I do have a couple of questions, and attendees, please, if you have any questions, feel free to just put them right in the chat, or there is a Q&A bubble that you can use if you prefer to do that. So I have a question on the employer side, Purvi. How does the American Rescue Plan affect have employer coverage, but you have dependents under the coverage that the employer does not contribute to? Does the American Rescue Plan do the decrease in premium payments affect people on employer plans but pay full amounts for their dependents, is basically the question.
Yeah, that's a really good question. So this was already something that happened through the Affordable Care Act. If you have access to what they call affordable employer coverage for the individual employee, you and your family are not eligible for the reduced premiums under the American Rescue Plan or under the Affordable Care Act. That was the structure that was set up, and I know that makes it difficult, but here's what I will say. To the extent that, because in some of these situations, the coverage that's being offered, like we do here in DC, you do not have to contribute a huge amount. You may not have access to an affordable employer offer, and it's worth going to check and apply and seeing if that offer is really considered affordable to you. And if it isn't, you could purchase coverage for your family members through the American Rescue Plan, through DC HealthLink with the reduced premiums. The other thing that's always important to check is, even if you have employer insurance being offered to you and your dependents, Medicaid, which is the free coverage in the District of Columbia, has free health insurance for children at very high, even with higher and with moderate income levels for families. It is very much worth applying through DC HealthLink, because if you're eligible for free coverage, that one pathway will give you that free coverage. And lots of families we see where the kids are enrolled through Medicaid and it's free, and then the parents are enrolled through their employer or buying coverage separately. Medicaid is very generous in DC, and that's really DC taking a stand to say children's coverage is so important. We want to make sure everyone has access to that care. So I really urge, again, it's the same pathway. You don't have to go anywhere else. If you go through dchealthlink.com and apply, you will be checked for Medicaid eligibility for you or your kids separately. And that's really important to do.
Yeah, that's great. And I'm glad that you pointed that out so heavily. That kids can apply separately. You don't have to use the employer insurance for your children or your other family members, correct?
That's exactly right. So you can go to dchealthlink.com. It's going to ask you your household income information, but when you get to the point of enrollment in Medicaid or private coverage, you can just enroll specific people. So you could just enroll the children. There is no requirement that the entire family stay together for enrollment in healthcare. So you can go through dchealthlink.com, you put all of your family's household information in, but then you can enroll your children for free, for example, in Medicaid, and continue to get your employer insurance. And it's so many people don't know that, and I'm so glad someone asked that question and we could share that information.
Yes, yes, that is a great question. Okay, so the next question was about employer contribution. If employers are unable to make any contribution, can they still offer any monetary contribution? Can they still offer the coverage to their employees, although the employees will be paying 100% of coverage?
Yes, and that is what the Zero Down program allows you to do. We have made that available all the way through 2022. Employers, a lot of times people just can't figure out how to get insurance, and it's overwhelming. And when their employer just says, you know, they can sign up with a broker and have their broker help their employees just go ahead and sign up for coverage, and they don't have to pay anything, or they can pay a small amount and they can just pick a reference plan, like one plan of which they're going to pay a certain portion, and just know that that's all they're going to pay. And then the employee can use that $0 or some amount of money and go ahead and shop for coverage. And they get access to all of those health insurance options that are available. Now, if that employee is being offered that coverage where they have to pay 100%, they can, but they think they can get this health insurance, this reduced premium health insurance through the American Rescue Plan, they can turn down their employer offer because it's not affordable to them. They can go to dchealthlink.com and sign up for coverage on their own. The employer offer with no contribution will not be held against them. If they are eligible at the income levels for reduced premium, or if they had been laid off anytime in 2021, even if they're working now, they can get coverage for reduced premiums. And remember, if you were laid off, the coverage could be as little as $2 a month. So it's a really good thing for those employers to just go ahead and offer it even without a contribution. So for folks who want to go ahead and purchase it for full price, they can. And if they can't, they can still go get the reduced premium insurance through dchealthlink.com.
Yeah, I mean, great. These are really great options. And also the minimum number to participate for employees, that has been waived as well for employer.
Minimum participation requirements has been waived, although to have someone purchase in that marketplace, in the business marketplace, you have to have at least one non-owner employee enrolled. That's not the same thing as a participation requirement, which was, 50% or 75, 2/3. Those are participation requirements. But just to be in the small business marketplace, you can't be a solo person business, like the owner is the sole proprietor. That means you're buying insurance yourself in the individual market. If you have at least one employee who is going to buy coverage, that puts you into the small business market. And then there are no other participation requirements. So if none of the other employees took the coverage, there's no problem there.
Okay, perfect. And another question here about brokers. Does a business have to get a broker on its own, or will they be assigned by a broker by HBX?
So you can pick your own broker. If you go to dchealthlink.com, there's a whole list of them. If you want to pick one, for example, that speaks a specific language, that would be helpful to you. or, you know, lives in a particular area or services a particular area. You can do that. There are many ways to help sign up. If you want some assistance, you can call DC HealthLink Call Center and they'll show you how to find a broker. The beauty of a broker is you don't pay them. We don't pay them either. The insurance companies pay them on the backside. It does not get reflected, you know, it is not something you ever pay in your premium. You do not have to pay anything, but that broker is helping you navigate something. That is their business. They understand how to sign up. They've been trained on what kinds of options there are, and they can help you sign up for coverage. If you have questions about how to use the coverage, they're there to help you with that too. So we really encourage people to sign up with a broker. But again, you can also go through the system on your own, because it is very easy to go ahead and sign up as a business. And you can go ahead and just go to dchealthlink.com and start the application as the employer and just work your way through. There are numerous guides available, videos that show you what you will need and how to do it if you really want to do it on your own. But it's always great to have a broker.
Yes, I agree with that. And RMW works with a few brokers. If you want to come to us and ask us to assist you in getting connected with the broker, we're happy to do that as well. Our brokers work directly with HBX also. And we have a question from the attendees. For small employers in DC with remote employees in many states, will all employees be part of national provider network? Is this network more narrow than non-marketplace plans?
Yes, so that's a great question. So as long as you have your business has some tie to DC, you can buy coverage through DC, and you can sign up you want to sign up for a plan that says nationwide coverage. We have very strong networks across the country, all 4 of our carriers in their nationwide plans. Just don't pick the plan that's DC only. You want to pick the nationwide plans. We do not have narrow networks in DC. We have been very lucky with our carriers and our negotiation. We have a very strong small business marketplace, and we have coverage across the country. And it is including Alaska, California, just anywhere you can think. And you're going to be able to seek care through any of the 4 carriers across the country. The one carrier that in some places does not have coverage, you can look that up, is Kaiser Permanente, but they do have a nationwide network in case you're there traveling for emergency situations. That is absolutely no problem. But if that's your home location, then you may want to pick someone who, you know, make sure to have that full nationwide location. Again, there are nationwide plans with all of our carriers.
Okay, perfect. So if anyone else has additional questions, please feel free to go ahead and ask it. I just have a question on my own now. With the carriers that are in DC HealthLink, if someone has insurance that is not a part of that aren't in one of the carriers, and they now want to go through DC HealthLink to get health insurance, would that all just flow over to the new provider, or they have to pick one of the carriers in the plan? Like, they can't just transfer their insurance to the marketplace?
Yeah, you have to have a DC HealthLink plan. And for businesses in DC, all businesses that are getting the Affordable Care Act coverage, so that, you know, that coverage that covers everything, everyone is supposed to be coming through DC HealthLink. There shouldn't be outside coverage. In other states, that is different. But here, that is how we got our competitive prices, by having everyone, all the carriers competing against each other and showing you all of their plans. So Kaiser Permanente, CareFirst, Blue Cross Blue Shield, United Healthcare, and Aetna, all of them offer plans through DC HealthLink. If for some reason you have coverage with someone else because you're through a different state, maybe you have 2 different locations, and you want to come through us, you will have to pick a plan that's here, because it has to be a DC HealthLink plan when you're coming through us. Now, I will say some people signed up for maybe some limited duration plans, 2-3 month plans. Those could be with different providers. Those do not offer comprehensive coverage. If something were to happen, they cap how much they cover you. In some cases, it's truly junk insurance. It's good to tie you over, but it is not helpful in situations where you really need coverage. And so you really do want regular Affordable Care Act coverage, which is always only through DC HealthLink. And especially right now, like we said, there's so much help paying for it in different ways. Don't let the cost push you somewhere else.
Yes. Great. Thanks so much. I have not seen more questions come through, but I think what we covered was very informative. The questions that came in were really great. And thank you again so much, Purvi, for all of your information and insight and just really breaking that down in a really understandable way.
I'm happy to be here. I really do, again, encourage you to share this information with folks. If you post it, Aishi, thank you so much for doing that, but just for folks to go ahead and send it around. And again, our website has even more information, particularly what's important starting April 1st under the American Rescue Plan. It's very important that folks go and see if they can reduce. I don't want to be an insurance commercial in terms of, like car insurance or homeowners, like you can save, so you really can. The American Rescue Plan has made it cheaper. So please go and see how it's made it cheaper for you, and if you can get lower cost coverage or if you can get free coverage.
Yes, and don't forget that your children can get covered in DC.
Yes, Medicaid is very generous in DC and offers free coverage to adults and kids, but kids at much more higher income levels for families, even in the very moderate and low, in those moderate income bands, children can be free. Don't delay in getting them signed up.
Thank you so much. And we will be posting this on RMW and also on our YouTube page and sharing via all of our social media platforms. Thank you again, Purvi, and I hope everyone has a blessed and healthy week, year.
Take care, everybody. Bye.